Hi, it's Maggie with Healthy Holistic Living, and we're talking about lower back pain. Piriformis Syndrome versus Sciatica. Which one potentially do you have, and what can you do about it? I've got an easy homework thing that you can do at home to relieve tension in that piriformis muscle, and an awesome killer find on a magnesium CBD oil that reduces inflammation and brings down pain immediately for me. Lower back pain is obviously something that I live with every day, so I always want to understand it better. And I ran into, on Stat Pearl's NCBI bookshelf, 6% of lower back cases are actually contributed to Piriformis Syndrome. That includes sciatica. That's 2.4 million cases a year that are struggling with something that could be resolved fairly simple. So we want to understand it first. So the sciatic nerve, that's the thing that we're all talking about. It exits through the spinal column. So we've got our sacrum. This is a plastic sacrum. This is the posterior side. It's the anterior side. So the vertebrae would just stack up on top of there. The sciatic nerve exits out the spinal column through the lower lumbar spine. And it kind of comes together. So through each one of those discs, that's why if you've ever had trouble with this, and you're like, oh, there's an impingement on L4 and L5, or you've got an impingement through your entire lower lumbar 1 through 5, or some people, it's really common to have an impingement through L5 and S1, so sacrum 1, lumbar 5, that's what they're talking about. So the nerves exit and they kind of band together. This makes this very wide. So it comes together, it cruises through the gluteal space, down the back of the hamstring, to the knee, and then sort of disperses down that lower leg. The pathway of this nerve makes it really easy for us to feel the pain or tingling or the irritation of it, but hard to kind of put our finger on it because there's so many individual nerves that are cruising through this pathway. It makes it the widest and the longest nerve in the body, which also means that not only is it responsible for so many functions down the leg, but it's so many opportunities for this nerve to become impinged or pressured or damaged or messed with. What's really significant about the sciatic nerve is that it runs on, under, or sometimes through the piriformis muscle. Piriformis muscle is named after its pear-like shape, and it attaches to the anterior portion of the sacrum and then out to that hip bone, that greater trochanter. So as I sit, I pull it away. As I walk, it pulls back. So this muscle is impossible not to use. It's one of our deep hip rotator muscles. So it's helping to rotate our hips, and it's deep in the body. So when this guy gets mad, it makes everything mad. If you've got sciatica, and it's true sciatica, the impingement's happening up in the lower lumbar spine. It means that it usually happens from a herniation or a bulging disc, a compact injury, something that's caused pressure onto the nerve. So you're having what's called true sciatica or just sciatica, and it impinges on that nerve. Piriformis syndrome, that nerve got caught inside the piriformis. So as it's cruising down through here, that muscle structure is kind of strangling it or squeezing it. This usually happens from chronic tension or overuse or lack of rest, or if you're sitting all day. We see a lot of patients who are truck drivers or have desk jobs that just don't ever get up and move. So that muscle stays in a lengthened position and becomes tired and frayed, and this is called a structural imbalance, and it finally just like bing, 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 like little guitar strings, and it tears or it starts to tighten down on that nerve. Either place that this nerve is being impinged, you're gonna experience tingling, numbness, pain, radiation, lava-like sensations. You'll have all of those similar sensations down one leg or sometimes both legs, depending on which way the nerve is being pinched on, because the nerves exit from both sides of the spinal column. If we got 2 legs, we need 2 nerve supplies. So that's basic understanding of sciatic nerve, and then sciatica, it's being pinched in the lower lumbar spine, and then piriformis syndrome is being pinched in the muscle itself. Treatments for sciatica is going to be maybe chiropractic, depending on the damage or the healthiness of the tissues, traction work, sometimes range of motion or stretching, yoga. Core strength is always an answer. You might need to consult your primary physician or get it looked at. Piriformis syndrome, luckily, is a muscle that's impinging this, so we've got some more stuff that we can do safely at home with just a tennis ball. Application of these at-home things are pretty simple. So you're gonna lay in zero position. It's on your back. You'll bring your knees up and your feet are flat on the floor. This does two things. It rolls your lower lumbar spine onto the floor, giving it maximum support and brings some slack and some flexibility into it. The second thing it does is it helps you control the leverage of your own body and your own body weight of how much pressure you put on the tennis ball and when you can kind of ease into it. So once you're in zero position, you'll take that tennis ball and place it in the piriformis or the gluteal space, and then ease your pressure onto that tennis ball. You can work it by lightly moving side to side or just let it sit and do its job. Breathe. Oxygen is really important for this. If it's painful, if it's making your symptoms worse, if it irritates something more, you should stop this exercise and perhaps seek professional advice or professional suggestions for this. But if it is just tight or tender, then breathe. Give the opportunity for the muscle to relax. It kind of takes a minute of that tightening away and then softening. So if you're experiencing softening, you're in the right direction. If all you're doing is feeling more tension and more pain, then roll off that tennis ball and seek professional help. If the topical spray is where you're headed, have at it, man. It's a CBD magnesium spray by My Core Essentials. Magnesium is so important for nerve and muscle health. It promotes relaxation, it reduces stress and tension, it brings down inflammation, and now you're putting it with this CBD oil, which we all know this ingredient is kind of like on fire for inflammation and pain relief. So the two together is just brilliant, and I love stumbling onto this. I'm proud of the company. They offer really good ingredients and they put it together in a really great way that feels safe for me and my body. So I use this daily. There's no consequence for me using it multiple times a day. So I will spray it on my lower back, I'll spray it on my glutes, and I'll spray it on my ankle where I kind of feel that fiery, tingly, uncomfortable space. The best thing that I like about this product is it works instantly. I start to feel the tingling and sensations immediately where it's bringing that relief, and I can see visible in that inflammation and pain, and I get to get back to playing. So definitely check this out. I will set up those links. I just want to say thank you from everybody here at Healthy and Holistic Living for watching, for paying attention, for sticking with us, and we will see you soon.